treatment now has talked about. But then even up to decades later, we've seen some 20 years later, they come back with metastasis. Cancers, and more so breast cancer, impact on all aspects of an individual's life. There's the physical impact, the psychological, the spiritual, as well as the social. But we need to note that despite all these challenges, life can return to normal if the patient has the appropriate supports that they need. So still on the introduction, I'd want to give a few quotations from several studies that have been done in Ghana. So by, I think, Mary Idrisu, by Prof. Ziato, and then also Prof. Clegg-Lamte. So the first person says, "It was not easy for me at all, and I did not take it lightly. I realized that I was in trouble, and I asked myself, where from this? For about a week or two, I was not myself. I could not sleep, eat, or think properly, and I saw my world crashing before me." Another one says, "Yes, I was very much afraid when I was informed of the diagnosis, because I haven't known a lot of people who have survived it. I knew a lot of people who don't go to hospital and have died, so I was scared. I thought I would be one of them." A third person says, "A day to the operation, my husband decided not to allow the operation to come on. I was subsequently discharged, even though the doctor wasn't happy about it. I was taken to a herbalist. In fact, I went through a lot." Another one, "Initially, I was frightened, so I didn't report for the surgery as scheduled. I was worried not only about the financial obligations, but also my age, as well as the lack of emotional support from a mother or a husband." And then the last quotation says, "Some people call it Aye Ahela, witch's disease. We have family or friends who have got such a myopic idea about breast cancer and think that the victims are bewitched." So from these various quotations, we can begin to appreciate what the patients go through, the emotional, psychological distress and trauma that the patients have to face. And as we go along, we'll talk about it a bit more. So looking at the patient's journey, so we look at the pre-diagnosis period, which is the period between when a patient is normal or a person is normal to when a diagnosis of breast cancer is made. So this could either be by screening, or it could be that the patient develops symptoms. And it's the health-seeking behavior of the patient that will determine when they show up in hospital or at the appropriate health facility for them to get the necessary investigations done before a diagnosis can even be made. And then there's the diagnosis when you end up in the hospital, the various tests that are done to confirm the diagnosis as well as to stage the disease for us to be able to move on to the treatment phase, where various treatment modalities, which Naa has discussed very well, can be employed. And then after treatment, there's either the survivorship when the patient responds to the treatment and lives for many years after treatment, or then we may lose some of the patients along the way. And even with the mortality of the patient, we have the effects on family bereavement and all that. So basically, this is just in a nutshell how the journey goes like. So looking at the challenges, we'll take it at the various phases. So for the pre-diagnosis, we have the factors that affect health-seeking behavior. And these would include factors like demographics. So several studies have shown that elderly patients, those who are less educated, single patients, those in rural and low socioeconomic classes tend to report to hospital late. They notice symptoms, but they will not seek early attention. There are also the cultural beliefs. I think Dr. Nketia talked a lot about the myths, the misconceptions. These all come into our beliefs and affect what we do. When you think that it's a spiritual disease, obviously, the first place where you would want to seek any attention would be either with a priest or a prayer camp or do something spiritual. Or if you think it cannot be cured, then really, what's the point of going to the hospital when it cannot be cured? So these beliefs actually affect how we behave and our ability to actually report quickly to a hospital and even to go through with the treatment. One of the patients said, a day before surgery, husband says, "No, you're not doing it." She ends up at a herbalist place. So obviously they felt the herbalist could offer more than the surgery could, and that's influenced their choice of what to do. And also the knowledge about breast cancer. So general knowledge, symptoms, myths, misconceptions, these all affect the decisions patients would take. And also accessibility of health facilities. So the distance, if you have to travel all the way from Tamale to get to Kumasi to have some form of treatment, radiotherapy, for instance, it may affect your ability to actually do so. And then also the availability of facilities with appropriate healthcare professionals and also finances. That's why we can't talk enough about it. So all these things affect the decisions that go into the health-seeking behavior and when the patient eventually will end up at the appropriate facility to be treated. For diagnosis and treatment, here it's mainly the health system factors that bring about the challenges. So accessibility of health facilities, like I've just said, availability of appropriate and adequate staff, availability of services. I noticed somebody had put on the question box that someone was referred to oncology and has been given an appointment for, is it 2 or 3 months? There are people there, they are working, but their workload is so much. So their dates tend to go rather far away. You come to the surgical OPD, the very first day you show up, you may not be seen, and you may be given a date 2, 3, 4 weeks away, all because of the workload and the availability of staff and services. Timeliness of the services. So if all these things are not in place, then obviously, although the service is available, you may not be able to get it in very good time. Attitudes of staff, I think Dr. Nketia mentioned that. And then cost of test and treatment. So we know NHIS covers breast cancer, but we all know that there are still out-of-pocket costs that have to be borne by the patient, and they are not cheap. The patients are expected to come up with quite a bit, and it may be prohibitive for some of our patients. Then there's also the misconceptions associated with treatment. So there are so many negative things said about radiotherapy, about chemotherapy, even about surgery, that once you have your breast cut off, you are going to die. And all these things pose challenges. They place impediments in the way of the patients coming and actually going through the procedure. So some would go through the chemo, but when it gets to surgery, they disappear. Some will go through surgery and not show up for chemo and radiation, partly because of some of these misconceptions they may have, in addition to other problems that may be there. Then there are also the side effects of treatment. So now discuss all the various treatments, and they all come with their side effects: chemotherapy, radiotherapy, surgery, hormonal therapy, every one of them has side effects. At times I say that even paracetamol that we all take so commonly has side effects. There's nothing that doesn't have a side effect. So yes, there are side effects, but the good thing is we know about them. So we can monitor them, pick them up early, treat them, prevent the ones we can prevent, so that the patients will be able to get the maximum benefit from the treatment without the side effects causing so much trouble. But when the patients focus so much on the side effects, then they may decide not to even show up at all for the treatment. And also the duration of treatment. I think I mentioned that it can take a very long time to treat breast cancer. And so with this whole long period of treatment, active treatment could be easily a year. And you have to keep coming to hospital, at times spending a few hours, like during chemo, for instance. Side effects may not make you so well. And when this is prolonged, then it tends to have effects on your daily life, your daily activities, work, family activities, and all that social engagement. So these are all challenges that the patients have to battle with. And then after treatment, in the period of survivorship, there's a problem with treatment adherence. So for those who are on hormonal treatment, you can be on that for as much as or as long as 10 years. Having to take a tablet every day at times can get a bit difficult. It also may come with side effects, which may make it even more difficult to adhere to the treatment. And then you should be going for regular follow-ups. And again, this is prolonged. So for 5 years plus, you may have to keep going to the hospital every now and then, and that can become a bit burdensome for the patients. There are also the long-term side effects, such as the cardiomyopathies, the lymphedema, which can affect the patients even years after they have had treatment. There's always the fear of recurrence or metastasis showing up, and that tends to psychologically really have an impact on the patient. Anytime something little happens, you have a headache, you wonder, is the cancer back? You cough, is the cancer back? You have a back pain, is the cancer back? It's really difficult to live with some of these challenges. So another quotation from a study, I think this one was done in Pakistan or was it India? People are telling the positive story, and obviously that's good, but I feel like there's another story to be told. Yes, I'm through it, and I'm incredibly grateful that I'm now living with a different set of circumstances, which are actually really difficult. I think that's the general population's view as well. You should just get on with it. But it's like grief, it doesn't go away. So the issue is that people Once you've been through the treatment, you've done whatever period, 6 months, 1 year, you've done surgery, chemo, radiotherapy, everybody looks at you and thinks that you are well. They expect that you should just get on with life. But it's not always so easy. There are difficulties that the patients face even as they go on from day to day. I've just talked about the fear of recurrence of metastasis. These are things that psychologically can really traumatize the patient. And one study even suggested that the period of survivorship would actually be even more difficult than the period of active treatment because of all these added issues and compounded by the fact that everybody expects that you finish treatment, you are okay, you should be grateful and you should move on. And it doesn't come so easily for everybody. And then for those who unfortunately do not make it, on the family, there's the impact, the bereavement that they have to go through. And especially if this is not handled properly, if this is not, adequate preparation wasn't made, the relatives didn't really get to understand what was happening. They didn't get to appreciate what was happening. It becomes more difficult. Even if you know and you understand, it's still difficult to lose a loved one. But when you are not expecting that at all, or where you feel like somebody hasn't done what they should have done, then it becomes even more difficult to handle that. So we realize that the challenges actually exist through the continuum of the disease, even up to the survivorship period, and it negatively affects the quality of life, especially if it is not well managed. Significant others are also significantly impacted. So like partners, husbands, wives also, for the few men who would get it, children, close family can all be impacted negatively. And these various challenges, as I've said already, can be physical, psychological, spiritual, or social. So we'll look at the various dimensions of the challenges. For the physical challenges, in the very early stages, there actually may be no symptoms at all. So when you pick a cancer, a breast cancer by screening mammography, it's not because the patient can feel anything or there are any symptoms, but the mammogram is able to pick something up. So in the very early stage, in terms of symptom load, it's really either not existent at all or very low. But as the symptoms, the disease advances, then the symptoms begin to increase. So you can have localized symptoms in the breast. You may have a big lump. Now the patient may begin to feel pain. It can get ulcerated. They can be bleeding. The breast can be so heavy. It's even difficult for the patient to walk around. And then it even becomes worse when it becomes metastatic. So now there are problems with breathing. Patients may have brain meds, be confused, agitated. They may have bone meds. They can end up with fractures, paralysis, liver meds, liver failure. So obviously, as the disease increases, the symptom load also increases, increasing the physical challenges. Side effects also contribute to the physical challenges. So even for the early stage ones, you need to treat. Patient has to have surgery. Patient may have to have chemo, may have to have radiotherapy. And it comes with its side effects: nausea, vomiting, fatigue, diarrhea, hair loss, darkening of the skin, neuropathy, cardiomyopathy, menopausal symptoms, post-operative complications, radiotherapy effects. The list goes on and on. And these are all physical challenges the patients have to cope with. And as we've said before, it's not just during the period of active treatment. Some of these are long-term side effects, and the patients may have to live with it for a very long time. Treatment effects, yes, I've just said that they are not just acute, but they can also be long-term. So cardiac dysfunction, lymphedema, chronic pain syndrome, chronic fatigue, cognitive impairments. These are all things that may persist for quite a while, even beyond treatment, or may show up even much later. So in a study that was done, it was shown that for patients who had been treated for breast cancer with mastectomy, only 16% were actually satisfied with their physical health. 83% complained of fatigue. So they had various combinations of treatments. 3/4 of them complained of body pains or headaches, problems with appetite, sleep disorders. About 63% reported weight loss, and 90% had general weakness. So this gives us a fair idea of what the patients have to cope with when they are going through treatment. And to quote one patient in one of the studies, he said, "Initially, when I went through the chemo, I did not take it easy at all. I had a weakness and I vomited continuously for 3 days, could not eat or drink anything. When I went for the next session, the doctor said I did not have enough blood in me. So he suspended the chemo and wrote blood tonic for me to go and buy. So this just goes to emphasize the fact that physically, treatment, chemotherapy, or the other treatments can actually affect the patients, give them some side effects. The good thing is that it's just for a period. It passes and the patient gets better. But going through it is difficult, and we need to encourage the patients to cope with it and also do all we can to help minimize the side effects and make it more tolerable. For the psychological challenges, cancer diagnosis usually incites a lot of fear and anxiety, and it can even result in depression. There are some people who don't even want to mention the word cancer at all. You may see a patient and treat the patient for so many months, and they will never even want to actually admit the fact that they have the cancer. They don't want to mention that word at all, just because of all the fear that it brings. And the fear is actually multidimensional. So there's the fear of the disease, there's the fear of the treatment. We've just talked about the side effects. We know for breast cancer, you may have to take off the breast. So there are also the issues, the psychological issues, body image, sexuality. There's a fear of the recurrence we've mentioned. There's a fear of death. We know that cancer can cause death, and so there's a fear of death. There's a fear of the financial implications, both from expenditure for treatment as well as losses because you are not able to continue to do your work. There's a fear of the impact on the families. We've heard of, or we've not seen, heard of, we've actually seen and had patients whose spouses have left them, divorced them because of breast cancer. There are effects on children. If patient, mothers especially are not strong enough to be there for the family, to work, to take care of the family, it can have negative impact on the children. And some of these children are also emotionally traumatized because they know about what cancer is and they are living in fear. Is my mother going to die? All these things can have very significant impact on our family members. Elderly parents, they expect that we should live and take care of them. So when they see their children going through some of these difficulties, it really is a major challenge for them. There's also the fear of stigmatization. We know all the sort of things that are said about breast cancer. People think it's a curse, it's a punishment from the gods, it's contagious. And so because of that, patients are stigmatized and they have to deal with all these psychological challenges. So we know that the breasts are generally seen as a symbol of femininity. And so some of the effects are heightened, especially when there's a need for mastectomy because of the distress over the change in body image. That women tend to feel less attractive and they think it will impact on their intimate relationships and also deficit in maternal caregiving roles. For one study that was done, patients who'd been treated for breast cancer, 74% had varying levels of anxiety and only about 10% were hoping to achieve a desired level. In another study, about a quarter to a third of the survivors had stress, anxiety, depression. More than 90% had body image issues. So this just gives us a good idea of what the patients have to battle with. Just to give two more quotations from patients. One day I was sitting on a bus talking to myself. I did not know where I was going until the bus attendant asked me where I was alighting. It was then I realized I neither had a destination in mind nor money to pay for. Meanwhile, my baby was at my back. I nearly got mad. Another one says, I fear that I may die and leave my husband and children. Though the nurses have talked to me, I'm still afraid I may die for someone to come for my husband and maltreat my children. You can imagine if you have such thoughts, how distressed you can be. I mean, the illness alone is enough, but then thinking about all these issues, what will happen to my children, what will happen to my husband, am I going to die, is somebody going to come and maltreat my children? These are really issues that can negatively impact on the patients psychologically. And then for the spiritual challenges, we know Ghanaians are very religious people. And when faced with any difficulties, breast cancer inclusive, we try to explain it from a spiritual perspective. Often we tend to feel that God has abandoned us. So then we may feel like it's a punishment or it's a curse from God. Many will seek healing from God in various ways. And if God doesn't take away the cancer miraculously, then we feel like our prayers have not been answered. So not even just that we have to, whether we are surviving the cancer or not, but the fact that we even have to go through the treatment, the difficult treatment, the chemo, the surgery, having to lose a breast, all those things are things that are tend to have a a significant impact on the patient, and they feel like God has abandoned them and God doesn't care and God is not listening to them anymore. And invariably, they tend to wonder, what is it that I have done wrong? How have I wronged God that He's treating me this way? It's a lot of torture for the patients. They tend also to engage in a lot of alternate healing, including faith-based healing, especially because we think that it has a spiritual connotation, or there's some spiritual explanation to it. And as we said before, this will lead to delays in presentation and non-compliance with treatment. And this goes on to result in poor outcomes, which continue to fuel the vicious cycle of more late presentations, more poor outcomes, and then we keep going on and on. Socially, we know relationships can be affected. So I've mentioned already partners, family, friends. We know how pivotal women are in the family and the society. And when they are affected by breast cancer, it negatively impacts not just on the family, but on the society as well. They tend to end up at times with low self-esteem because of the body image issues, lack of motivation, poor concentration, anxiety, depression, and all these things will contribute to making them socially isolated. So they don't tend to go for functions anymore. They tend to want to stay at home, stick to themselves, not interact with anybody. There's also the cultural beliefs and norms in the society, which can affect how patients respond to symptoms and a diagnosis of breast cancer. Accessibility of well-equipped health facilities also impacts on the patient's health-seeking behavior and the treatment. So if in the community we don't have good health facilities, then obviously it's going to be a problem for the patient to go out looking for care. Still some more quotations. One patient says, when I go for the chemo, I'm not able to cook and also care for my children. So you can imagine, what are these children going to do? Who is going to cook for them? How are they going to eat? How are they going to thrive? They may end up also affecting their schoolwork and all that. Another says, I've lost my long flamboyant hair. The long hair I decided to hold and twist anyhow. People used to admire it a lot when I go to the salon, and now my husband has been complaining about the loss of my long, beautiful hair. Another patient says, my husband complains about the wig and says I should not wear the wig, but I cannot live without the wig. I just don't feel comfortable at all seeing my scalp bald. So such a patient may even have it difficult going out because he wants to wear a wig and go out, but husband also says, no, you shouldn't bother about that. So all these things bring conflict and difficulties for the patient. Another says, I cannot go out. I cannot wear a bra because of the pain. And also my nipples point out in my dress without a bra, and it's embarrassing to me. Such a patient, you can imagine, will just be isolated at home, not interacting with anybody. And that can worsen the issues of depression that these patients may have. And so what's the way forward? Education, as we are doing. It's important that everybody is educated. Excuse me. The general public, the patients, as well as we, the health workers. Patients need to know that it's once you are diagnosed, it's a long treatment. And even beyond the long treatment, there may still be challenges. Once you have some idea of what to expect, it becomes a bit easier when the problems come and when the challenges arise. But if you feel like, oh, breast cancer, after surgery, I'm done. And then suddenly after surgery, they say chemo. Then after chemo, they say radiation. Then after radiation, they say something else. And it's like it's never ended. It becomes very difficult to cope with it. So education. It's very, very important. It helps us all to be able to cope, for the patients, for the public, and for we, the health workers, also to know that it's not just about the patient has been treated and that is the end of it. So when they come for follow-up, we need to look out for some of these problems we've talked about. When they are going through the treatment, now I talked about the various side effects of different chemo agents. We need to look out for it, ask the patients about it. So we need to be aware of all that is happening, all these challenges that the patients may be facing, so that we don't just, for us, it's just focusing on give you the medicine, do the surgery and go away. But we need to know that there's a lot more going on physically, spiritually, socially, psychologically, and we should actually look out for all these challenges and try and help the patient cope with them. So education comes with training. For those in the medical field, we need to be trained to be able to handle the patient well, recognize the various problems and be able to deal with it. If we can't even deal with it ourselves, if somebody's having psychological issues, should be able to at least recognize it to involve the psychologists in the patient's treatment. On the part of the government, there should be widespread availability of well-equipped treatment centers, because that helps patients to be able to readily assess it. And then also the financial support. The health insurance is doing some, but a lot more would be welcome. And we all need to advocate that financial support is improved, not only from the top, but also amongst ourselves. So if you have a relative, a friend going through these treatments, you know how costly it is. It's good that we can also chip in from time to time at our workplaces. If there are policies to help take care of health, all these things are very useful and help to limit the difficulties and the challenges the patients face. Empathy and support. So from general public as well as from us as health personnel, like I said, it's not just that we are taking care of the patients and that is it. Yes, you've given the patient chemo, but then the patient is going through so much emotionally, and it wouldn't hurt to empathize and support the patient in that direction as well. And then we need to remember that it's not just an acute thing, it's chronic. It can go on for treatment, like we said, can go on for a very long time, and some of the side effects and the problems may be prolonged. And so we need to look at it in the light of it being a chronic condition and manage the patient as such. We need to offer rehabilitation, especially for the psychosocial problems. Those are usually we tend to just focus on the physical, and that is it. But we need to remember that there are so many other aspects that are affected, and we need to work on getting all those aspects taken care of as well. So we should have a high index of suspicion for the challenges that we've talked about, be able to actively identify them and manage them appropriately using a multidisciplinary team. So obviously, the oncologist alone cannot handle all these problems. The surgeon alone cannot do that. But we need to rope everybody else in using a multidisciplinary approach. And as we do that, then we are able to sort out the various challenges that the patient may have. So all hands should be on deck, right from the government to the society, family level, as well as with the healthcare workers, not just strictly doing our work as we see it, giving chemo, giving radiation, doing surgery, but looking out for all the challenges that the patients may go through as a whole and trying to deal with those as well. So in conclusion, I would say that challenges do abound with the diagnosis of breast cancer, and it extends through the continuum of the disease, right from even before the diagnosis is made into the survivorship period. It can be physical, psychological, spiritual, and social, and it can negatively affect the quality of life of the individual, but also of the family and the greater community if it is not well handled. So we must actively look out for these challenges and try and manage them at every level of the journey with a multidisciplinary approach. And improving our health systems was definitely useful, because then, depending on the various ways in which it's done, availability to facilities, accessibility of healthcare workers, the various facilities to be able to get timely service and all that, it all goes to take care or to help treat the patient quickly and in a holistic manner so that the challenges would be reduced. All right, so these are my references. Thank you.
Thank you very much, Dr. Dede, and I want to thank